Hi, my name's Steve Schmitz. I work with Clinical Solutions. I'll be respectful of the time component with this in-service, but this is going to cover the ROHO dry flotation mattress overlay system that we provide to your facility. First and foremost, the ROHO is intended to manage pressure. It does an excellent job of doing that, and in addition, it can manage shear forces in the patient's immediate environment and also friction. And we address friction in a large part with this nylon fitted cover sheet which goes over the ROHO itself. That addresses friction on the surface of the product. Basically, utilization of the ROHO is going to be driven in part by your visual assessment of the patient and also the Braden scale which you're doing, which is a very objective way of looking at variables that contribute to breakdown. I think it's important not only to look at the total Braden score in terms of assessing risk, but also look at the subscales on the Braden. And I'm speaking specifically to sensory perception, activity, and mobility. If the patient is not mobile and not moving a lot, you're going to need a surface that's going to manage pressure very well, and the ROHO is capable of doing that for a number of reasons. There are two primary reasons why this product works as well as it does. First of all, it's divided into 4 sections which snap together and are placed on top of a traditional foam mattress in the hospital. The sectional design of this product is intended to allow us to address body parts that are resting over each section individually. I need much less air support over someone's heels than I do over their bottom. So I have the ability with these valves that are located on either side of each section to make the necessary adjustments to allow for envelopment and immersion of bony prominences and ultimate pressure redistribution. And if you carry that thought a little farther, what ROHO uniquely does is it provides what's called force equalization. On the bottom of the ROHO, if you flip it over and look at it, you'll notice that all these individual air cells are interconnected with each other. So when I'm expressing air out of any one or any number of cells, it's being shared equally with all the other cells in that section. And what that equates to is a restoring force or a return force to the load that's applied that is equal in all areas. And that's unique to the ROHO product. Very effective, again, at managing pressure. There are some things you need to know clinically about the ROHO. They're important to remember. One is in a CPR situation or an emergency situation, you always want to use a cardiac board with this product. It's never stable enough, and there may be some recoil with chest compressions on this that would be contraindicated. So always use a cardiac board on this product. And again, always set it up on a traditional foam mattress. That gives it a good foundation, a good stable foundation. When you're getting a patient in and out of bed with the ROHO applied, if it's adjusted properly, it's really only adding about 1 inch of height to the underlying surface. And that's because if we get proper immersion of tissues on this surface, we are well enveloped into the ROHO itself, and we have about 1 inch or 1.5 inches of air between tissue and the base of the unit. So we're only adding about 1.5 inches of height to the overall system. You can treat all stages of wounds with this product, and it can also be used very aggressively for prevention in high-risk patients. I want to take a moment now and just show you the cover of the product. This is a fitted nylon cover. It is manufactured for ROHO and designed to be used specifically with this product. What we recommend in most situations is that when you place this on the ROHO, you cover just the ROHO itself and not the base mattress. That does 2 things. It prevents stretching of this material to the point to where we have what's called tenting or hammocking of the material, which prevents the base unit from from operating properly. And you can, as a consequence, develop skin issues because of that. So a loose fitting cover is a good thing, and we can achieve that by securing the cover underneath the ROHO itself and not the base mattress. This also affords you the opportunity when you're repositioning and turning patients, if you're putting someone on their side for a while, rather than putting a pillow on top of this, and between the patient and the therapeutic surface, we can now lift the ROHO and place the pillow underneath it and always maintain contact with the therapeutic surface. Another real benefit of that to those who are actually physically involved in providing that to the patient is that the pillows tend to stay in place a little better using this approach. It can be very frustrating to come in and find that all the work you put into repositioning a patient is for naught because the pillows are now slid out from underneath the patient. And this helps with that situation. I'd now like to take a moment and show you how to properly adjust the ROHO to the patient. On either side of the unit, as we mentioned initially, on either side of each individual section are valves which allow us to add air or remove air from the system. If you need to remove air from the system, this valve can be turned in a counterclockwise position and the air will bleed out of the section, much like a bicycle tire. The valve is very similar to that. In order to assure proper inflation, we need to do what is called a hand check. And this procedure is presented on a sheet of paper with each ROHO that we provide to your facility for your reference. Basically, what you need to do is slide your hand underneath this cover sheet until you get to a point to where you're under a bony prominence. It can be a heel, sacrum, scapula, spinous process, occiput, but you need to do each of the 4 sections in the same manner. So basically what I'm doing is I'm sliding my hand palm side down underneath the patient's heel here until I get my middle finger directly under their heel and over the cell that it's resting upon. You then want to gently open this valve by turning it in a counterclockwise manner and move your middle finger up and down. And you want to do that with the bony prominence on top of it until you get to a point where you have about an inch to an inch and a half of travel between the top of your finger and the base of the unit. So you want to be moving your finger like that. It's a very subjective type of a setting, but it's adequate to assure good immersion and envelopment of the heels into this section and of bony prominences into the other section. You can have the product too soft, and that can be bad because the patient would bottom out then, and we don't want that to occur. So doing a hand check is important to assure optimal pressure redistribution and also to assure that we have adequate support for the tissue load that's being applied to the section. Once that is completed, obviously we turn this in a counterclockwise, in a clockwise situation or direction then to seal it, and we move on to the next section. If you need to add air to the system, this is a hand pump that comes with every unit that's kept on the nursing divisions. And what you do in this situation is simply slide this over the valve, turn it again in a counterclockwise direction. It's a little tight there, but I have it open now. And in this situation, we would be doing the same thing, but we would be adding air by pumping air into the section. Again, going back under and doing our hand check. Once we have the adequate amount of air, we simply turn this clockwise and remove the pump from the valve. And now the section's been properly adjusted by adding air. And I think in most situations, you're going to be removing air rather than adding air from the system. ROHOs are typically overinflated. That's been our experience. So remember, we want good envelopment and good immersion of tissues throughout the surface of the ROHO. And again, we repeat this process for each of the 4 sections. You can approach it from either side because, again, there are valve stems on either side of the ROHO. Finally, with respect to the cover, this cover is made of a waterproof material. So if it becomes soiled with body fluids, it can be wiped off. And if it becomes badly soiled, you need to contact Clinical Solutions, contact your representative, and we will provide a fresh cover for the ROHO. Thank you.